Healthcare is a big concern for many of you this election season. Now, you've told us this through your comments and your questions on our political coverage.
It was brought up as a topic to discuss with every candidate we have interviewed so far. KRIM 2's Rob Harris explains the candidates' answers have kept those questions and the debate going.
One answer in particular has gotten a lot of attention. A viewer sent in a question for Congresswoman McMorris Rodgers asking about healthcare for eating disorders. And the Congresswoman answered like this.
I believe that we must ensure that those with pre-existing conditions are protected as we move forward.
And so you would not vote for legislation that didn't have a protection for those with pre-existing conditions?
Right.
Okay.
And I haven't.
It's that little bit right at the end there that has people arguing. Rodgers voted last year for the American Health Care Act, known as the AHCA for short. It was supposed to repeal the Affordable Care Act, but it didn't end up becoming law. So, is the Congresswoman accurate when she says the AHCA had protections for pre-existing conditions? To sort through it all, I turned to Elizabeth Wood. She works on healthcare policy studies at Washington State University. Technically, yes, the AHCA did have a protection for pre-existing conditions. The bill included the MacArthur Amendment, which bans companies from limiting access to individuals with pre-existing conditions. But individual states could get a waiver if they showed it would lower average premium costs or increase overall enrollment. And Wood says this is the big concern. In those states with waivers, insurance companies can charge people more for 1 year if they let their coverage lapse for more than 60 days. And those higher prices could push people away from getting coverage. Wood told me to protect people with conditions, you need to make sure they can't be rejected and to make sure they can actually afford coverage. I reached out to Congresswoman McMorris Rodgers' office for a response, and her spokesman Jared Powell told me the higher prices in states with waivers would have been applied regardless of a person's health status, and the intent was to keep individuals from lapsing in their coverage. He also told me Kathy remains committed to ensuring those with pre-existing conditions cannot be charged more or denied coverage. In any further healthcare reform efforts, she will continue to fight for access for those with pre-existing conditions. Brittany, Jen.
Rob, thank you so much.